Okay. Good evening and welcome to this seventh webinar that was foreseen for this workshop. Today we are going to talk about two very essential functions at the national level. One is the processes of reporting, recording, and notification of occupational accidents and diseases. Basically, during this session, we will talk about why it is important to report, record, and notify occupational accidents and diseases. What are the information that should be reported? What is the use that national authorities may do with the information provided? We will see some good practices, and we will also provide some documents and guidance materials on what is the best way to work in these processes. Later on, we will talk about the different schemes on employment injury insurance. That is the way in which ILO named the processes and for compensating the occupational accidents and diseases. I mean, basically to cover the cause of occupational accidents and diseases to the workers. We will see also some experiences, some good practices that different countries have implemented in this regard, and also why are good practices. So for the first part of this presentation, we will have with us Dr. Yuka Ujita, who, as you know, is the senior specialist on occupational safety and health covering Southeast Asia and the Pacific. And she will introduce all this topic. Dr. Ujita, whenever you want, you have the floor.
Thank you very much. So good afternoon, good evening to you all. I'm sorry, my background is a little bit, because just this early this week, we have the ASEAN OSHNet meeting, and I changed my background. Now it's okay. Good. So thank you very much, Felix. And again, good afternoon, good evening to you all, my colleague. I believe you enjoy the series of the webinar so far, and we learn a lot from the presentation and the exercise, practice, and discussion. And today, the theme is the collection and the use of the data. And actually, this is my favorite topic. And I'm so excited to discuss with you. And actually, I'm really looking forward to working with you on this topic. And today, my presentation consists of the three parts. The first is the technical presentation, and it's not very much lecture type, but I like to share what kind of tools are available, and also it's followed by what kind of assistance the ILO can provide, because this issue, the collection and the use of the OSH data is very difficult, not only for your country, but actually globally, many countries face a challenge. How to collect, how to analyze, how to manage, and they publish the data. So let's start. And the last part is the exercise, because I will present later, but I provide some technical assistance to member states, and a part of the technical assistance is the training. So I try to share that the exercise with you. Anyway, first of all, the issue is why recording and notification is important. Maybe I need to stop my video. I can't. It's okay. So why recording notification is important? Because effective prevention can be achieved only by evidence-based policy and strategies. For example, ILO has policy, ILO has the strategies. However, there is no fit for all. You need to adjust, modify, tailor the global policy and strategies according to your situation, your own condition. Then you need the data, you need the information to identify the issue, prioritize the issue. So that's why this is very, very important. For example, you remember that the second session I presented this figure. That is as I said, you remember, this is the latest ILO estimates. Why estimates? Because we don't have the correct statistics, reliable statistics, because we do not have data, information directly collected from the member states. So that's why this is just an estimation. Also, I share this slide. This is the WHO-ILO joint estimate. This is the big, and we try to be accurate as possible. However, again, this is just an estimate. Then on the same session, I presented you what is the promotional framework look like. What is the ILO's systems approach to OSH? Then, and you remember there are 4 elements: OSH policy, system, profile, and programs. And then I explain the diagram, how to improve your national OSH system through this promotional framework. Then this is the recap of my presentation, and through your learning process. Yes, you remember you have the national OSH system, and you have the national OSH policy, and there is a gap between the system and the policy. So you need to improve the system towards the policy. How? By PDCA, continuous improvement cycle. How? You need to have the national OSH profile first. Then, based on the profile, you may develop the national OSH programs with the very clear priority, very clear action plan, very clear indicator, and the monitoring evaluation system. Then, the 3 years, 5 years later, you need to evaluate what did you achieve, what you could not achieve. Then, again, back to the profile, program, evaluation. This is the PDCA cycle. Then, you see, when you develop the OSH profile, you need to have the data and the information. What is the current system, current situation, condition of the safety and health at work? How many accidents you have? How many disease, how many injuries you have? That is the very, very important component of the OSH profile. Then, of course, once you implement the program, you need to evaluate your achievement, right? Then again, you need the data. This is very crucial, very important to get the data, especially accident, disease, and injury. This is the very, very similar, the same to the enterprise level. This is, again, I presented already, that the same PDA cycle can be applied to the company level. Then, again, it's the same. Company, enterprise needs to have data. Then they will develop the company OSH program or the OSH plan, implement the plan, then evaluate the achievement. So data is required, necessary at the national level, but of course at the company workplace level. Okay, so this is the background, this is the concept. Then what kind of data, what kind of information is required by international labor standards and also your national legislation to develop evidence-based policy and programs? Let's see. The Convention 155 has the specific article that is the composition, the component of the national OSH policy. And Article 11, Section C, the Section C, it is very clearly indicated that the establishment and application of procedure for notification of occupational accident disease by employer. But when appropriate, also insurance institutes and other directly concerned agency should produce annual statistics on occupational accident disease. So it is required by 155. Then they continue the D section. There is the hold inquiry where cases of accident disease arise from the work is the situation which are the serious. So this means, in other words, investigation of the accident, injury, and disease. This is also required by 155. Then E is just one step further. The national authority needs to publish annually the information on measures taken to the Article 4 is the national OSH policy. So the publication, the share the information, publication of the information and data is also required. However, Convention 155 is the very short, very concise provision regarding the data collection and the use of the data, only the three sections. Then the 155 is accompanied by Protocol 2002, P155. So actually the Convention 155 is supplemented by this protocol. This protocol is very specific to the collection and the use of the data. I do not go further, deeper regarding the contents of the Protocol 2002 because it is accessible. You can visit the ILO's website and download Convention 155 as well as Protocol 155. It provided the definitions of the occupational accident, disease, and injury. Why? Because if the definition is different from one country to another, we cannot compare, we cannot analyze the accident and the injury disease between or the among within the member states. So the ILO provide a very clear definition. Of course, you can adjust, you can modify. However, I will present you later, even beyond the OSH, the statistics convention, they provide a very clear international global definition of the occupational accident and injury and disease. And this protocol provides a system for recording and notification, also the requirement of the national statistics. Thank you. All right. So this is some legal, it's not a legal, but some provision by the international labor standards. Just for information, as you know, recently, many countries try to ratify 155. because now it is the fundamental conventions. And some, not all actually, but the many countries ratified both Convention 155 and Protocol 2002, Protocol 155 at the same time. Recently, Australia ratified 155, both Convention and Protocol. And just for information, Thailand is now very close to the Convention 155 ratification, and ILO is supporting the government to ratify. Then we provide advice. What about the protocol? And then now Thailand is changed direction. Then both ratification of both Convention and Protocol 155. Just for information. Then, as you may know, ILO has the dedicated department, that is the ILO statistics department. ILO stats collect the data and information from all member states, and the occupational safety and health data as well. When you access to the ILO stat dedicated webpage, you can see the OSH data from member states. Especially, I will present later, ILO stat publish the data from member states regarding SDG indicator, and that is the fatal, non-fatal occupational injury. But anyway, when you visit the ILO stat, you can see this kind of data. It's the very clear figure. And some countries report to the ILO regarding the occupational injury, non-fatal and fatal injury. However, it is unfortunately it's not the many countries. Regarding the Asian and Pacific, the country which report annually is very, very limited, to be honest. And from the Pacific, not so many countries, unfortunately, can be able to report the OSH data to the ILO. So the reporting to the ILO is not the purpose, the aim to compare with the other country, but it is very important to measure, to evaluate the progress of your country's, your own protection measure on safety and health at work, right? So my hope, I really want all countries in the Asia and Pacific can report, maybe not annually, not every year, but to share their OSH data with us. That is my hope, my dream. Anyway. Okay, so these are some framework. Then let's go to the more detailed technical matter. What should be reported, recorded, and notified? Maybe some of you are confused reporting, recording, notification. I will speak very soon. What is the definition of the reporting, recording, notification? In the ILO's terminology, it is clearly different. So let's go. This says, the definition of the occupational accident, disease, and the dangerous occurrence is here, provided by Protocol 155. And we suggest all member states to apply this definition, maybe with some modification can be. And the accident is an occurrence arising out of or in the course of work which result in fatal or non-fatal injury. So please note that when the ILO says occupational accident, it is nearly equal to occupational injury, right? Both fatal and non-fatal injury. see, almost we use these two words, accident and injury, the very similar setting. Then the occupational disease is the any disease contracted as a result of an exposure to risk factor arising from work activity. So very often, ILO's document says occupational accident and disease, because the accident is nearly equal injury, but disease is totally different. Also, you may have the national list of occupational disease, isn't it? Right? And the definition of the occupational disease is different from one country to another, and according to your national list of occupational disease. However, in theory, occupational disease should include any disease as provided here. It may include work-related disease, right? So ILO doesn't have the definition for work-related disease. However, in practice, actually our real life, some disease, illness, cannot be attributable to the only one cause, only one factor. Usually it's the multiple factors. For example, the ischemic heart disease, for example. As I said, long working hours is one of the cause. But at the same time, ischemic heart disease is based on their own lifestyle or their family history. So many other factors exist. So in that case, in practice, ILO and also WHO call it work-related disease. But as a definition, occupational disease can cover any disease. Then the dangerous occurrence. This is up to your regional national legislation. Some countries cover dangerous occurrence as occupational accident or recording notification requirement. Other countries not. Or some countries say incident. Or some countries say near miss. But in the ILO, we do not use the near miss. We do not use incidents. In the protocol and also the code of practice, we use the dangerous occurrence, but it's, you can see, under national laws and regulations, okay? Then another very, very important definitions is the indicator, SDG indicator 8.8.1. And member states should report this indicator through ILO, because the ILO is the custodian to the SDG outcome 8, and especially 8.8. So you need to report this indicator, fatal and non-fatal occupational injuries per 100,000 workers. This is the key, by sex and by migrant status. And here is the detailed definition. But to be honest, at this point, very, very few countries can report this indicator to the ILO. Why? Because many countries have some disaggregated data by sex, but not migrant status. So very few, but some EU, European country, and also in Asia, for example, Malaysia has, and the other, it's very strange, but the Myanmar has data by sex and migrant status. Singapore has, and the Japan doesn't have. South Korea not. Of course, Australia has. So this indicator, definition of indicator is very, very important because it is required for the all member states of the United Nations, sorry. Then another definition is, as I said, reporting, recording, and notification. This is very confusing, especially between the reporting and notification. Maybe I will respond to you, Helen, later. Sorry, no? The reporting is the procedure specified the employer for the submission by workers to their immediate supervisor or the competent person about the accident, injury, or the disease. So reporting is different to the notification. Reporting is a subject, is the worker. Workers needs to report accident, injury, or some disease to the direct supervisor. That is reporting. Then recording is by employer to maintain information. That is recording. This is very obvious. Then notification is the procedure for employers or insurance institution to submit information to authority. That is the notification. So I think many countries use the reporting instead of notify or the notification, right? But in the ILO, the protocol 155 clearly said this is the different procedure. So this is the more easy to understand for you. Every step is starting from the reporting of the accident and disease or dangerous occurrence, incidents, near miss, from workers to the direct supervisor. That is the starting point, reporting. Then supervisor or the employer needs to record accident and disease, right? Then they are required to notify authority or the authorities regarding that accident and disease. Then from here, actually there's the two players. Then notify the authority like Minister of Labor or in some cases Minister of Health should analyze accident and disease, right? And develop preventive measure or publish the statistics, then implement the measure. That is the from reporting, recording, notification to prevention. At the same time, employers, they need to notify authority. At the same time, employers or the company needs to analyze the accident and disease and develop the preventive measures in the company, then implement the prevention measure, right? So from here, analyzation, developing the preventive measures and the implement measures are two players. One is the national authority and also the company or the employers themselves. So this is the flow from the reporting to prevention. Is it clear? I hope. Then what we can do to strengthen, enhance this flow? First, we need to develop national system engaging multiple agencies, of course, Minister of Labor, inspectors, or the Minister of Labor, or the employment. But regarding the disease, very often we need to engage Ministry of Health or the medical doctors or the hospital. Inspectors, of course, they are the key player to collect and the use of data. And already the 155 provided social security institutes is a key, because very often, even though employers or the workers fail to notify authority, usually they notify social security to get health care or the compensation for the money, no? So the social security, very often, they have the better data from the labor administration. This is the reality. And of course, the data and information should be published. So we need to engage statistics office as well. And in some countries, the Professional Association of Occupational Safety and Health will be also engaged, like Indonesia. They need to engage the OSH Professional Association. Then what about the workplace level? We need to build the capacity of both employers and workers, because as I said, every step started from reporting. So if the workers do not know about their obligation, do not know about the procedure, no reporting started. So we need to enhance the rule, obligation, mandate, and the capacity of employers and workers. Okay, so this is the last slide of my first part. Maybe can I go to the next part? This is the just tool available in the ILO. As I said, we have the very specific convention 160, and the labor statistics convention, it has one element, occupational injury, and as far as possible occupational disease. This is the convention article 1. And the code of practice, this is very, very important and very useful, actually. And I strongly suggest you to visit this, download this code of practice. It is not new, but still valid. Then this quick guide, we developed in collaboration with the ILO Statistics Department. This is the very easy tool, not only for the OSH practitioners, OSH person, but also the general public. What is the OSH data? Then, more specific, this is the investigation guide on accident and disease, mainly for the inspectors, but not only inspectors, also employers and workers, because very often the integrated investigation, the joint investigation is suggested or provided in the country, many countries. Then this is the labor inspection statistics harmonization, because the LMI is you have some of the countries in the Pacific is working on LMIS, and the harmonization of the all labor administration data, inspection data is a key. Okay, then this is I really suggest to you very concrete brochure. It's not the book. It's just a very short brochure. For one is the employees and managers. Another one is the workers. We have the two types of the same brief guide. Then this is very useful, very concise, and that just the brochure. So these are the tools available. You can download from the ILO's website. Okay, so now let me stop to share my presentation, then directly go to the some very short video, because based on that, the last slide, the brochure, we developed the very short video. You can use in the workplace, you can use in the somewhere else. It is very easy to see. So I like to share that video now. I need to share sound. Okay. I cannot see that. This one. I hope you can see this. I cannot see. I'm sorry. How can I do that?
We can see your video.
Okay, okay. You can hear the
Yes.
sound.
Okay.
Preventing occupational accidents and diseases is key for the productivity and sustainability of your business. Effective prevention can be achieved by designing and implementing policies and strategies based on data and information. International labor standards stipulate that all employers employing one or more workers should make adequate arrangements to record and notify the competent authorities about occupational accidents and diseases. They also stipulate that employers should make arrangements to facilitate workers' cooperation in the fulfillment of employers' obligations. In most countries, their recording and notification to competent authorities is an employer's obligation. What events do you need to record and notify to the competent authority in your country? An occupational accident is an occurrence arising out of or in the course of work, which results in fatal or non-fatal injury. An occupational disease is defined as any disease contracted as a result of an exposure to risk factors arising from work activity. As appropriate, dangerous occurrences are readily identifiable events as defined under national laws and regulations, with potential to cause an injury or disease to persons at work or to the public. Commuting accidents are accidents resulting in death or personal injury occurring on the direct way between the place of work and 1. The worker's principal or secondary residence, or 2. The place where the worker usually takes a meal, or 3. The place where the worker usually receives his or her remuneration. Who should do what? There are several things that employers can do to facilitate reporting, recording, and notification of accidents and diseases. In consultation with workers or their representatives, set up a mechanism for workers to provide the necessary information to supervisors or employers. Provide information and training to workers on the reporting mechanism and recording arrangements, and on how to reduce the risk of exposure to similar events. Promote that workers follow the agreed reporting mechanism at the enterprise and provide the required information to the employer's representative. Identify a competent person who receives and records information on occupational accidents, diseases, commuting accidents, and dangerous occurrences, notifies the competent authority, investigates, prepares reports, and carries out corrective actions, and keeps records. Maintain the records to ensure they are available at all reasonable times. Ensure that policies are in place to prevent retaliatory or disciplinary measures against workers who report. Ensure confidentiality of personal and medical information. Employers who fail to notify the competent authority, as required by national law and regulations, may incur penalties or face prosecution. Cooperation between employers and workers is essential to ensure safety and health for all. Improving occupational safety and health means improving global health. For more information, visit ilo.org/VZF.
Okay, so I stopped sharing my video, and okay, now I can answer to the question. Let me see. What do you call the exposure of workers' rising temperature as a result of climate change, especially for the construction workers, for example? Yes, what do you call? This is what do you call? It is this is the exposure to the risk factor or the hazards, no? The temperature itself is a hazard, right? And is irrespectively by the climate change or the before the climate change, some workers exposed to the heat, not only for the outdoor workers, but indoor workers. But you are right, now is the risk to expose to these particular hazards are increasing, right? So this is the risk factor. And according to the exposure to heat, if that workers face the accident, for example, that is the occupational accident due to heat exposure. If the workers are suffering from the heat stroke or some kidney disease or the heart disease, that is the occupational disease due to exposure to heat. Did I respond to your question? And to be honest, this heat issue is the very emerging, and I'm working very, very hard in this region. And maybe later I will share with you the very simple brochure I developed for the Thailand, but now is translated in Myanmar, Cambodia, and Laos, maybe Laos. Because the Myanmar, for example, after earthquake, the many people, not only workers, but the public exposed to the very high temperature. Now, actually, now in Bangkok, this is the highest, hottest season. So I can share the heat, but this is another story. Okay, so another question, can you explain more on occupational disease? To be able to accurately report the occupational disease associated with the occupation. Occupational accident injury is yes, of course, the occupational disease, the very important element is the very clear correlation. The exposure to some hazards in the workplace or the occupational exposure to some factor relate to the disease. That is the clear definition, correlation between the exposure to particular hazards at work and the disease. That is as you said, the associated with the occupation. It actually is not the occupation, construction or agriculture. It doesn't matter. It's not occupation, but exposure to particular hazards, maybe dust, maybe heat, maybe the noise, but it should be occupational exposure. So that is the occupation disease. I'm so excited about this. Thank you. Does Ebola fall in the category? Of course. When the Ebola pandemic, the ILO, including myself, we are the team to address the Ebola as occupational disease. It's the same, the COVID-19 or the flu influenza, the avian flu. All these, or for example, some country in the Pacific, malaria or the dengue, it can be occupational disease. And in fact, the list of occupational disease of the ILO has some bracket area. If you can make the evidence, the occupational exposure to specific virus or the bacteria is some disease, that is the occupational disease. So let's see, the ILC is upcoming in June. The ILC will discuss the new instrument, convention, and recommendation of biological hazards. The discussion was very hot last year. But anyway, they discuss what is the biological hazards and what is the action to be made. Okay. Any other question? Mental health and well-being, yes. More traction and awareness in workplace. The Pacific, we are not well exposed to such aspect of OSH. Yes, this is another very good question. And that's why now the ILO has the specific OSH project in my region, the decent work team in Bangkok, we have the OSH project very focused on one, mental health, two, heat. And the mental health should be, that is the exposed to the psychosocial factor, and the mental health disease or the any health problem is occupational disease. Very clear. Okay. Right. Actually, I have another two parts, but maybe I noticed that the time is running. So let me share just a few more slides. Then I stop and they give the floor to これか。give to Felix to continue the discussion. So let me, sorry. Okay. So let me finish my presentation. How can I assist you to strengthen the reporting, recording, notification system? Actually, this is my passion. So I'm doing a lot in the region and ASEAN and Pacific actually. And I make a package of the technical assistance. Just for information, the improvement of data collection, OSH data collection, is one of the priority areas of the ILO for more than 10 years. The last decades, this is the one of the priorities in the ILO program and budget. Then I have the package of the approach. It started from the case study. Case study is the mapping exercise, what kind of system you have, and what kind of system the enterprise capacity the company has. Because very often, the problem is no one knows what kind of data, who has what kind of data, and how they collect and use the data. We don't know where the data is located, where the data is available. That is the starting point. We need to have the clear picture, which ministry, which agencies has what kind of data, how we can access that data. That is the starting point. So that is the case study mapping exercise is the first step. Then that mapping exercise should be validated by all agencies, Ministry of Labor, Health, or the other relevant construction, whatever, energy, whatever the ministries, and also Social Security Statistics Office. That mapping, the figure should be validated. And at the same time, they need to develop the roadmap, how they can improve the collection and the use of the data. Then at the same time, they build the capacity at the enterprise level, as well as the inspector is the key, no? So I provide the very concrete training using the data and the reporting form. I wanted to try this training today, but I don't have time. But these three actions as a set. For example, this is the case study. Only Samoa in the Pacific, these three package was already done in 2023. And of course, it started from mapping exercise. And the August 2023, the Samoa published the very short report regarding the reporting, recording, notification. This is the part of the report. As you can see, it showed what kind of action, by whom, to whom, what kind of incidents to be reported or the recorded or the notified, and what is the legislation as the required legislation. So this is the Samoa case, and also this is the another case is the Brunei. Brunei is it is the very interesting a little bit complicated, but this kind of figure diagram is very helpful. Yeah, these are the employers. This is the employers of domestic workers, self-employed people, contractors, operators. If something happened, they need to report to whom, what kind of form, what kind of incident, and the data is going to where, right? And which agency, ministries has a responsibility to publish the data. And I did this kind of study in many countries. In the Pacific, only Samoa, but Brunei, Mongolia, Thailand just finished, Malaysia, so many countries, Japan, some countries, Laos, PDR as well. So this is very useful. Then validation by tripartite partners. This is the example from Laos. And these 5 areas is their roadmap. What is the action to be taken? Raising awareness, centralized system, incentive for the reporting, recording, notification, capacity, and social security. These are the result and the identified action. Then training for the Malaysia. This is for the rubber globe industry. And usually I use the video, very easy video to show the case and fill the form. This is the assignment, no? And discuss how they can make a prevention action and the priority action, present action plan. So these are the package, and I'm happy to provide and do this kind of activities in your respective countries. So I stop here, and maybe another chance I will share the exercise. Thank you very much. And they hand over to you, Felix.
Thank you very much, Yuka. Just I would like to ask participants if you have any questions for Dr. Ujita.
Yes, Felix, I have a question, please.
Please.
Thank you very much, Yuka, for the comprehensive presentation. It's very important that the enforcement of, the reporting of occupational disease and injury for a country like Cook Island or any country that has not adopt the OSH 155. What's your advice in terms of like a focal ministry or focal person to report any injury or any occupational disease in a country like Samoa? Is there a system in place where workers from any ministry, identify an injury and report directly to ILO? Or like, for example, for public health, we have the Pacific Public Health, surveillance system where we report any disease outbreak. So I'm asking if there's a system similar to that to report for a country like, small country like Cook Island.
Okay, thank you very much for your question. It doesn't matter you ratify 155 or not. In any case, you need to collect data, no? And I believe even for the very small country, you have any kind of system to reporting. Of course, so many underreporting because the lack of the capacity, lack of the incentive, lack of the system. I fully understand. However, in any case, you need to collect the data, no? And trust me, even for the big countries, they don't have the very established system yet. For example, Pakistan or some state of the India, they don't have the system. And in fact, many cases are reported to the ministry through the news. because if the people die in the village, you can imagine what is the very quick and reliable source of the data? It's the news, no? Or the police.
Right.
And actually, even in the Asian countries, the police should play important role. For example, Vietnam, the fatal accident should be reported, notified to the police, not the other ministries. Now is that they changed, but before it is police. So the first, what you need to start is the mapping exercise. What is the current system? What is missing? Then you need to change, you need to improve. Otherwise, it's very difficult to discuss without the knowing the current station. But we have many, many cases. So let's work together.
Thank you.
Thanks. You can let me share my presentation because I have some complementary issues to which has already mentioned by Dr. Ujita, including this fact that you were asking for. Let me share my presentation. And basically, I would like just to talk about these employment injury schemes that are the systems through which one country basically collect information and compensate this occupational occurrence like occupational accidents and diseases. We will talk about employers' injury schemes or occupational diseases, etc. Your countries most basically used to have one system that is named workers' compensation systems. That is based on employers' liability. It means that employers, when they have an accident, they have the obligation normally to report to a unit, an office of the Ministry of Labor or another ministry that has is the competent authority for this purpose. When they have this information, they said that the occupational origin of this accident or disease, and then require the employer to pay compensation for medical care or hospitalization, and also the salaries or not covered or any other costs related with these occupational accidents and diseases. However, I want to bring to your attention that there are other modalities on how countries are organized to collect information on occupational accidents and diseases and to pay compensation. I was mentioned to you that your countries are mainly under the systems of employers' liability system, in which when there is an accident and disease, at the end is the responsibility of the employer of covering this cost, I mean, the cost of accidents and diseases. There are some countries that has set the voluntary possibility or the obligation that employers should purchase a private insurance. So when an accident happens, is this private insurance the ones that cover this cost of the accidents or diseases? So these systems, there is around 40 countries in the world that they have these systems. There are another system that has become more popular that is called the social insurance. The social insurance, basically, all the employers are required to pay a percentage of the payroll to public institutions that normally is part of the social security of the country, or is another separate institution in charge of occupational accidents and diseases. And basically, all the employers pay. And when an accident or disease happen, the employers are required to inform to this social insurance institution. And this institution pays the worker for medical care, compensation, etc., etc. What are the main difference between all these systems? Regarding liabilities, in the first system, this is, I mean, it has to be said that there are liabilities by the individual employer to compensate. In the social insurance, it's a no-fault system. When an accident or a disease, an occupational accident or a disease happen, the social insurance pay for this cost, and they don't care if they are the responsibility of the employer or the responsibility of the worker. They pay just to cover this cost. Another thing, another difference is what happens when there is a serious or fatal accidents, or that they have a permanent disability or survivor's benefits. Frequently, when there are individual employer's liability, if it has employer direct compensation or the employer has purchased a private insurance, normally they pay a lump sum to the family or to the injured worker, or they pay a periodical payment with a limited duration. Instead, frequently social insurance schemes make a pension. I mean, they pay periodical payments with indexation. I mean, they update the amount according to the level of life or the increases. Regarding medical care, these systems of individual employers' liability, normally they have a limited duration, and social insurance schemes are, they provide medical care as long as it is needed. In terms of rehabilitation, the employer's liability systems is not available. However, in some social insurance schemes, particularly when there are specific and separate institutions in charge of occupational accidents and diseases, normally is available. So they provide not only compensation, economic compensation, but also vocational training, physical rehabilitation services so that the worker come back to work. Regarding the delivery of a benefit, when the individual employer there is an accident in a company, when this employer liability has been insured with a private insurance institution or a social insurance, basically the good thing is that the compensation is guaranteed by the social insurance or by the private insurance, but not always by the employer. Imagine that an employer have a fire in the company, so the employer lost everything. So how this employer can after pay for compensation to some workers that can be injured if they don't have the financial resources to do that. The prevention sometimes is available in the social insurance. It means the employer, with the amount that they pay for compensation to the social insurance, also receives services for rehabilitation of workers and also sometimes for prevention services. How is the financing? The financing of the compensation, in the case of employers' direct compensation, is funded by each employer. Is when you have an accident, each employer that has the accident pays. In the other cases, when there is any kind of private insurance or the social insurance, it's a collective responsibility to cover. I mean, it's financed collectively. And there are the chances, as mentioned before, of employers' insolvency when, for example, there is a major accident. Instead, when you are funding a private insurance or a social insurance, there are not these risks for insolvency. So in general terms, from the workers' point of view, is quite good to have a social insurance. Here you have a map in which you can see how are the countries that they have a social insurance schemes. They are these the blue ones. This one on gray are those that they use to have employer liability systems. Many of these countries with employers liability systems are countries that they have a tradition, a British tradition. This employers liability can work pretty well, but they have the main trend of the country is to move for these social insurance schemes. What are the coverage normally of this employment injury insurance? Occupational accidents, occupational diseases, and sometimes commuting accidents. We will see later how occupational diseases are recognized as occupational. What are the covered populations? In general terms, all employees with working contract, trainees, sometimes public officials, military and police forces are excluded, but they have their own schemes. Not always self-employed, employer, students, and domestic worker, housewives are included. But for example, in some countries are included. For example, in New Zealand, self-employed are included in this, they are covered in this scheme. I mean, if a self-employed have an accident, they are covered. Of course, the self-employed has to pay for this thing. Who are the ones that are not included normally? Workers in the informal sector, and the disease of an unborn child as a consequence of the working conditions of the mother are not covered. It means that if something happened to the mother may have a pension for her, but if this damage affect the unborn child, this unborn child has not the right to receive a pension. I mean, frequently, according to the rules of this employment injury system, maybe the mother may decide to take the employer to the court to get the compensation by other means, but not under the rules of this employment injury systems. Here you have the percentage of the population of the working population that is covered against accidents and diseases at work. In blue, there are the percentages, dark blue of 80% or more. Medium blue is 60 to 80%. Clear blue is 40 to 60%. You see, in the world, there is around 37% are covered, males, and female 33%. These are data of 2023. What benefits normally are provided by these employment injury systems? Basically, there are some benefits in cash for temporary incapacity, invalidity, pensions, lump sums, and some benefits in kind. Normally, the most common one is healthcare. But also, as mentioned before, some institutions, particularly the social insurance institutions, they provide prevention and rehabilitation services. The healthcare frequently are medical and pharmaceutical treatment, prostheses, orthopedic devices, functional rehabilitations, and sometimes also occupational or vocational rehabilitations. Sometimes you need to train again the worker to do a different work because imagine that one lost the mobility of their legs, but they can be rehabilitated to perform all the type of duties. The cash benefits that normally they provide these systems, they are subsidies for temporary disabilities. For example, if you are out of work for 30 days, they pay you frequently, there's, let's say, 60–70% of your salary during this period. They provide also compensations, lump sum or pensions. In some social insurance in many countries, when you lost some kind of, you have an impairment, you lost the mobility of an arm, for example, if the if the level of disability is below 30%, frequently you receive a lump sum, an amount for this disability. If the disability is above this level, you receive a pension, a periodic pension every month for this permanent disability. What are the damages that normally are compensated? In some countries, they compensate the physical damage or also called impairment. In other countries, compensate the disability of work, and in another countries, they compensate both. Let me illustrate what is the difference between impairment and disability to work. For example, imagine that you lost the mobility of your, in an accident, the mobility of your legs. For someone that is a computer programming, probably the impact at work is not very high, because basically he can continue doing this programming. But if you have other type of work, like for example, a policeman or something, I mean, the level of disability of work is very high. Or in another extreme case, imagine that you lost the mobility of your 4 fingers. Sometimes if you have the problem of mobility of the fingers, is a very small level of disability. It will be of the impairment. I mean, it will be, let's say 10–15% of impairment. But if you are a pianist or a violinist, the level of disability of work is very high, because you cannot play piano and violin anymore. So it is important to see what the system will compensate, the impairment or the disability of work. Here you have how important it is to distinguish between impairment and disability in the system when there are compensation. Here you have the definition of the World Health Organization that can be used. Let me just show you that when you have to rate or to evaluate the impairment for an accident and disease, frequently there are different guides to the evaluation. The most common one is the used by the American Medical Association. These are documents that are used by the physicians, the occupational physicians, to estimate how is the level of impairment that a person suffering an accident or a disease may have. And according to this impairment rating evaluation, will receive a compensation of different kind. This rating schedule, well, basically is a guide to assist these specialized medical doctors in the evaluation of impairment resulting from occupational accidents and diseases. Basically, is a quantitative estimate, and they try to see what is the loss of function that you may have. In the platform, I have uploaded an example from Canada on one of these rating schedules that are used, for example, in this province or in one province of Canada, just to illustrate. These social insurance schemes frequently are organized under public bodies, but there are other options. There are, for example, some countries that have organized this social insurance with employers' associations under the public law. For example, in Germany, the employment injury scheme is managed by the employers' organization and workers' organization. It means they are a bipartite organizations. Employers pay 100%, but are managed by workers and employer representatives, and normally includes worker people from unions and people from employers' organizations. but they are public law institutions and they are non-profit. There are other countries, like for example, Argentina or Colombia, that they have some private companies. They are insurance company. Employer has the obligation to purchase one of these insurance companies for covering the compensation of occupational accidents and diseases, and these are profit companies. Some of these profit companies provide also rehabilitations and prevention services. Sometimes because they are obliged by the law, and sometimes because there are the way that they have to compete among them to bring more employers under their services. So this is the way in which these services could be organized. The financing in these systems of insurance, they have different characteristics. There are countries in which you have an uniform rating. All the companies pay a percentage of the payroll, for example, a 3% of the payroll, to cover any kind of cost on occupational accidents and diseases. But any company pays according to the payroll that they have. I mean, and all the companies pay the same. I mean, administrative companies, they pay the same than mining or construction companies. There are other countries in which they have differential rating. It means that according to the sector of activity, you pay more or less. There are some companies that will pay more or less according to the sector. For example, mining sector and construction sector will pay more because they have more level of risk than administrative or manufacturing companies. And then there are other type of financing that are experience rating. So in these cases, basically, companies start paying according to the level of risk of the sector. For example, if you are in the construction sector, you pay, let's say, 6%, but they take into considerations your performance in terms of number of accidents and diseases that you have in your company. And if you have less than the average of the sector, they have some discounts in your rate. And the opposite, if you are a company that you start paying 6% because you are in the construction sector, and you have a lot of accidents, the cost of your insurance increase in 8-9%. So these are some of the characteristics. Why they have these experience rating systems? It is just to incentivize companies to perform better on the prevention of occupational accidents and diseases. However, there is a risk here in this experience rating because some companies may decide that try to reduce the number of accidents, not because reducing the accidents, but reducing the reporting of the accidents. So another thing that is important, you see, imagine this series. There is a work activity that with some risk to the worker, you may have an accident and you have harm. Sometimes this harm is so serious that that the worker is out of the labor market, and this is a cost for all because basically the public authorities or the employer has to provide compensation. So the rationale of some of these companies is, well, the way to avoid this cost for all could be first to try to make to return to work as many injured workers as possible, even if they have a reduced capacity, so that they can earn more money and at the same time they are not a burden for the system. Similarly, they say, okay, as much money we can devote to preventions and to help employers, companies employers and workers in the prevention of occupational accidents and diseases, the less people will be injured, and the level of the cost that it will have the systems will be lower. Here you have some example from South Korea. In South Korea, there is a public body that is called OSH, in charge of the insurance of occupational accidents and diseases, and they have some policies of return to work. Here you have two graphics in which they show the impact that it has in 5 years' time, these rehabilitation policies, in the number of days that people take to return to work. Before having these return to work policies and rehabilitation activities, the average number of days of long-term injured workers was around 270 days. After implementing these rehabilitation policies, it reduced in almost 90 days less. I mean, basically, they have almost 190 days or 180 days. So one of the impacts of these return to work policies is that you reduce the number of days that you are paying a pension, a sick leave pension to the people, because you make them to return to work as soon as possible. The other aspect is that before, these people that they have serious accidents, in 2005, the rate of people returning to work was 25%. And with these policies, in 5-6 years' time, they managed to increase almost 12% more the number of workers that returned to work, to the original workplace. They realized that sometimes it's not so simple that one worker, according to their level of impairment or disability, can return to the same place. But they can provide this vocational training or this physical rehabilitation, and they can go to work in another place. So after 6 years' time, 70% of the people can go can return to work, particularly those suffering this serious injury. So the impact in the workers and the impact on also in the cost is very relevant. Yuka was mentioning about the definition of occupational disease. However, countries normally are much more restrictive in terms of recognized occupational diseases. Occupational disease, as Yuka says, any disease contracted as a result of an exposure to risk factor arising from poor activities. But frequently, countries recognize only diseases that have a specific or a strong relation to the occupation, generally with only one causal agent, and recognized by the authority as such. And sometimes differentiate between occupational diseases that are always notifiable and compensable because are cause-specific, and the exposure to the workplace is essential and occur mainly on working population. And they differentiate with war-related diseases that occurs largely in the community. They are multifactorial in origin. It means that you can be related with occupational and non-occupational exposure, and in which exposure to workplace might be a factor together with others. Might be notifiable and compensable, but frequently the burden or the proof to demonstrate that this disease has an important part related with the occupational exposure is the worker has to prove that, and this change from country to country total. For example, some of you were asking about if Ebola it could be an occupational disease. It is, like COVID. COVID was an occupational disease, provided that you prove the occupational origin. And in some countries, they decided that, well, if you were a nurse, you were a medical doctor working in a hospital and you get COVID, automatically they were declared as occupational disease. But what about these other staff of the hospitals that they were not nurses and occupational doctors? They were covered. In some countries, yes, in some countries, not. So the rationale doesn't work the same in all the countries. Each country decides these kind of things. The Convention 121 identified 3 ways in which one country should develop a system for the identification and recognition of occupational disease. The most common one is the list system that prescribes a list of diseases that can be considered as occupational, and has the advantage that for these listed diseases, there is a presumption that they have occupational origin. For example, if you have a disease that is called Saturnism, and you work in a sector in which you work with lead, for example, you produce batteries or something. So automatically, this disease, if you work in a company with lead, is automatically recognized. So this is the list system. There are other countries that they have a general definition system. Basically, in this country, they say occupational disease is any disease that is related with occupational exposure, provided that you prove that you had this occupational exposure. So this system, the general definition system, theoretically cover any kind of disease that could be demonstrated as disease. The problem is that the burden of the proof to demonstrate the occupational origin is under the hands of the worker, that normally is the weakened part just to demonstrate this occupational origin. The best system is the mixed systems that prescribe a list of diseases that can be considered occupational, and basically it says, okay, other diseases not included in the list could be recognized as occupational, provided that you can prove the occupational origin. So they take the best size of these other two systems. So the list of occupational diseases include a number of diseases and what are the specific work environments in which there are harmful substances or processes that can cause these diseases. There is a presumption of link between the occupational exposure and the medical conditions using these criteria that are called Bradford-Hill criteria. These are criteria used for medical doctors just to set the link between the occupational exposure and the disease. Normally, the list of the occupational diseases should be established by regulation. It will be better that will be set in an annex or of a regulation, because frequently has to be updated quite frequently. In fact, even the ILO that has elaborated several lists of occupational diseases, periodically they elaborate this. They repropose a new list, including more diseases as occupational. ILO has elaborated a list of occupational diseases with more than 100 entries. You have copy in the platform, and basically ILO proposed this list of occupational diseases for the member countries for their adoption. Why the list of occupational diseases is important? The list of occupational diseases is important not only because are the diseases that should be compensated if someone gets this disease, if a worker gets this disease. When a disease is included in the list of occupational diseases, they have other effects that are very, very important. One is that employers are required to notify any disease of this kind to the public authorities. The second effect, much more important, is that it creates the obligation to the employers to adopt measures to prevent these diseases. Because when we say that officially in a list of occupational diseases, that this specific disease is related with occupational exposures, we are telling enterprises, look, you have to adopt measures to avoid this kind of diseases. So for the first time, this list of occupational diseases includes some mental or behavioral disorders, and it is foreseen that the ILO in the next 4 or 5 years, maybe they will periodically review the list adopted in 2010. There is a very interesting document. It's a document elaborated by the ILO that was called Diagnostic and Exposure Criteria for Occupational Disease. This is a document that has around 600 pages. It took more than 10 years to the ILO to elaborate it together with many institutions, universities, public bodies of different parts of the world, and basically provide some information on what are the way of diagnosing occupational diseases and what are the exposure criteria associated to each disease or each occupational disease to declare that this is occupational. This is, for me, is one of the best books that the ILO has produced in quite recently. And I recommend to any of you that will be related with all these things. Here I'm just showing some examples on how different data could help in the decision-making process. This is an Asian countries. You see that over the years, they have less than 200 or around 200 fatal diseases, or not fatal, occupational diseases. And then they made 2 decisions, one in 2005, one in 2008. And the number of occupational disease suddenly increased. What they did in 2005, basically they provide a training to the doctors to recognize the occupational origin of some disease. As a consequence of this training or this guidance to the medical doctors, the number of diseases that recognized as occupational increased 150%. In 2008, they decided to update the list of occupational diseases, and the number of occupational diseases in 4-year times, it was 4 times this amount. So you will see, okay, here we have 2,000 occupational diseases. Here we have 200. So you may say, okay, are we better here? And the reply is yes. The reply is yes, because here we know the disease that have occupational origins. Probably we have the same disease here, but they were never recognized as occupational, and we didn't know that we have this kind of diseases, because only we know about these diseases at the occupational level when they are reported, when they are notified to the public authorities. But as mentioned before, the implications are more than the compensation of this disease, the compensation of these sick or injured workers. It is very important, of course, the compensation of injury and sick workers. But the most relevant thing is that we can tell the enterprises of these 2,000 people, look, you have a harmful process, a harmful substance that are producing these occupational diseases. So you have to adopt measures to prevent the occurrence of this kind of disease. So we will reduce this disease. And in fact, here you have also an example from Korea in which you can observe what is the effect when we increase the list of occupational diseases with additional diseases recognized as occupational, like for example, low back pain. You see that the increase of low back pains produce an increase in the number of from almost 3,000 to 6,000 and then 7,000 workers that have this kind of disease. But the good news are that as soon as you recognize these diseases, of course, public authorities and enterprises start considering this musculoskeletal disorder as a serious problem and will adopt preventive measures. So you will see that progressively there is an impact in the reduction of these diseases or these musculoskeletal disorders, these low back pains, because before we didn't consider like an occupational disease. But when we start considering occupational disease, public bodies, inspectorate, employers start doing things to reduce this kind, to reduce the causes of these low back pains, okay? So here you have another example. In this case, this is an example from Germany. This is the consumption of asbestos, and this is the number of cases of asbestosis, lung cancer, and mesothelioma. That is also another cancer that they had over the years consequence, because these diseases are linked with the exposure to asbestos. So they, with the data on the number of cases of asbestosis, lung cancer, mesothelioma related with exposure to asbestos, they made the decision here to ban asbestos, because they say, okay, this substance is killing us and apparently is quite difficult to control. This analysis that were made in Germany was the rationale for their decisions of banning asbestos. It was the same in UK, it was the same in Japan. They made this analysis between exposure to asbestos and the number of fatalities related with asbestos exposure. Or this is what they did also in Canada. This is production of asbestos, and these are the deaths related with asbestos. So this is the rationale for which many countries decided to ban asbestos. In fact, at this moment, there is around 72 countries that have banned the production, importation, use of asbestos in their countries. I have brought to you some examples of different forms, because I remember some of you were interested in this form. Here you have an example of reporting forms. These are the reporting forms that we use internally here in ILO Turing Center. This is a form for reporting hazards that workers can see around. This is a form that are to report an accident and incident to the center, to our safety and health management. And there are some different reporting forms that can be used. This is just an example. Here, instead, you have examples of recording forms from Occupational Safety and Health Administration of the United States. Basically, all the accidents that you get in your company has to be recorded, and you should keep this record for 5 years. You have also the obligations that at the beginning of this of the year, you have to send this injury and illness incident report to the Occupational Safety and Health Administration. So this is one of the ways that they are using, for example, to collect information regarding occupational accidents and diseases. Here you have also examples of notification form. How this is a report from used in the Health and Safety Executive in United Kingdom. This is a reporting form from Canada, from one of the provinces of Canada. From Australia. And there are some incident notification form that also is used to report accidents. So this is what I wanted just to show you and to share with you. And I will be happy if you have any question regarding with all these things that we were discussing. Any question or any comments? Sorry, I have took too much of your time. Okay, so thank you very much for your attention and for your participation in this session. If next session that we will have it tomorrow, if you have any question or you have any issue or any request in this regard, don't hesitate to do it even in the next session that we will have tomorrow. Okay. Thank you very much, Yuka, for your presentation and for sharing your experience and your knowledge on these topics. It was quite interesting to see all the things that you are doing there. So I will ask you for more information about that. Thank you very much to you all.
Thank you.
See
Thank
you
you.
tomorrow.
Bye.
Thank you.
Goodbye, everyone.
Thank you.
Bye-bye. Thank you.
Bye.
Thank you.